Welcome to Niga Med Guide. Today we are going to discuss about anatomy of tongue, papillae, its blood supply and nerve supply. Tongue is the muscular organ that is located in the oral cavity. It is covered by mucous membrane and plays a vital role in taste perception. Mastication means breaking down food and swallowing of food. It is attached to the floor of the mouth by lingual frenulum. Frenulum is a fold of tissue that connects one movable part to a rigid one in the oral cavity, just as lingual frenulum connects the movable part as tongue to the floor of the mouth, that is rigid structure. Tongue is divided into two parts. Anterior 2/3 is the oral part, that is visible and movable portion of the tongue, responsible for taste perception, mastication and speech. Tongue papillae are also found on the anterior oral part of the tongue. Posterior 1/3 is the pharyngeal part, that is rigid and located towards the throat. Lingual tonsils are found in the pharyngeal part of the tongue. These two parts are separated by a V-shaped groove, that is terminal sulcus of the tongue. Lingual papillae are the small visible bumps on the ventral surface of the tongue, responsible for taste perception and manipulation of food. There are four types of lingual papillae, that are circumvallate papillae, filiform papillae, fungiform papillae and foliate papillae. Circumvallate papillae are dome-shaped papillae present just anterior to terminal sulcus of the tongue, arranged in an inverted V shape. They contain many taste buds responsible for taste perception. Filiform papillae, the most numerous and conical shaped. The most distinctive feature of filiform papillae is that they do not contain taste buds, so are not involved in taste perception, but they play a role in increasing surface area and enhancing friction between food and tongue. Fungiform papillae are less numerous and mushroom shaped, present mainly on the tip and the sides of the tongue. They contain taste buds and involved in taste perception. Foliate papillae are leaf-shaped and are found on the lateral edges of the tongue. They also contain taste buds and involved in taste perception. Let's talk about the blood supply to the tongue. Arterial supply to the tongue is by lingual artery, that is the branch of external carotid artery. Venous supply is by lingual vein that drains into the internal jugular vein. Nerve supply to the tongue. All intrinsic and extrinsic muscles of the tongue are supplied by 12th cranial nerve, hypoglossal nerve, except the palatoglossus muscle, that is supplied by 10th cranial nerve, vagus nerve. Sensory innervations to the tongue for pain, temperature and touch is by lingual nerve, that is a branch of mandibular nerve that is further at division of 5th cranial nerve, trigeminal nerve. Glossopharyngeal nerve, 9th cranial nerve and vagus nerve, that is 10th cranial nerve. Lingual nerve supplies the anterior 2/3 oral part of the tongue. Glossopharyngeal nerve innervate the posterior 1/3 pharyngeal part of the tongue, and vagus nerve innervates the base of the tongue. Nerves for the taste are cauda tympani, that is the division of 7th cranial nerve, facial nerve, and glossopharyngeal nerve, that is 9th cranial nerve. Cauda tympani innervates the anterior 2/3 part of the tongue, that is oral part, and glossopharyngeal nerve innervates the posterior 1/3. Let's summarize all this lecture. Tongue is the muscular organ located in the oral cavity. It is divided into two parts. Anterior 2/3 is oral part and posterior 1/3 is pharyngeal part. and these two parts are separated by a groove, that is terminal sulcus of the tongue. Tongue papillae are visible bumps on the ventral surface of the tongue responsible for taste perception and food manipulation. There are 4 types of tongue papillae, that are Fungiform papillae, Circumvallate papillae, Filiform papillae and Foliate papillae. Blood supply to the tongue. Arterial supply is by lingual artery and venous supply is by lingual vein. Nerve supply. Motor supply is by hypoglossal and vagus nerve. General sensory innervations for pain, temperature and touch is by lingual nerve, glossopharyngeal nerve and vagus nerve. Nerves for the taste are glossopharyngeal and chorda tympani, a branch of facial nerve. I hope this video was helpful for you. Don't forget to like, subscribe and share my channel.